So good day everyone. We are going to have our rationalization for the quiz we have about C-reactive proteins which was conducted last Monday. So although you have already known the answers to the different questions, but I think it would still be best if we are going to run through the questions and then try to understand why the specific answer is the best one for the particular question. Okay, so now let us start with this question. A patient's serum sample was tested for CRP and serially diluted to 1 over 2 in 8 tubes. Agglutination was last seen in the fourth tube. So if the factor provided is 6 milligrams per liter, so what is the result of the test? So let us try to visualize it by having 8 tubes. 3, 4, 5, 6, 7, 8. So every one or each tube has the 1 over 2 dilution. So let's try to write. Okay. So 1 over 2 up to the 8 tube. 2 rather. So what we are going to look for is the final dilution because that is what we are going to multiply with the factor that was given. Okay, so 1 over 2 will be retained in tube number 1. So multiply the denominator with the denominator of the previous tube. So this becomes 1 over 4, 1 over 8, 1 over 16, 1 over 32, and so on. Okay, but our concern mainly is tube number 4. So you get the final dilution, say the dilution factor is 16. You multiply that by the factor, which is 6. Okay, so that's why you are going to have 96 milligrams, sorry, 96 milligrams per liter. 6 milligrams per L. So this is going to be your final answer. So the answer for this is 96 milligrams per liter. Now, let us go to the second question. Okay. High titers of CRP is observed in bacterial infection compared to infections caused by viruses. So what is the best explanation to support this statement? Okay. So remember that your CRP is actually, or mainly the substrate for CRP is actually the phosphocholine found in the bacterial membrane. Okay. So therefore, your CRP production is mainly responsive to the presence of phosphocholine. So therefore, the answer is its main substrate is phosphocholine, which is common to bacterial membranes. So being a pentraxine, having a 118,000 to 144,000 Dalton of molecular weight, okay, is not actually contributing to why is it much more responsive to bacteria than viruses. Okay, so also the last choice, okay, so it does not really contribute, okay, to the response or the high levels of CRP in bacterial infection compared to viral infections. Okay, now next question is, a 43-year-old female patient has a CRP level of 1 over 96 milligrams per liter. She has a blank risk of acquiring coronary artery disease. So based on the lesson, you have three categories for the risk of individuals for coronary artery disease based on their CRP levels. So if you have less than 1, so that is you have a low risk. Okay, if you have 1 to 3 okay, milligrams per liter. So you have an average risk. Okay, but if you have more than 3 milligrams per liter, so that is you have a high risk for acquiring coronary heart disease based on your C-reactive protein levels. So since what was given in the problem is that your patient has a 1.96 milligrams per liter, then therefore she belongs in this category. So therefore that is having an average risk for acquiring coronary heart disease. Next, okay. So a medical technologist or MedTech A performed semi-quantitative detection of antibodies against Salmonella typhi on a patient's serum. The test resulted to a high titer and is about to release the result when MedTech B informed her that she just finished testing the CRP levels of the same patient using the same sample and gave a result of 768 milligrams per liter. So what is MedTech A supposed to do? Okay, so if you could understand the question, MedTech A is performing antibody detection, okay, the presence of antibodies in the patient's serum against a particular bacteria. Okay, so since it is bacterial infection, okay, you can actually realize that, of course, expected that there is high titers of CRP. Okay, so that's why when MedTech B informed MedTech A that the CRP levels of the same patient, okay, using the same serum sample resulted to a 768 milligrams per liter, okay? So therefore, there is really high levels of CRP, okay? So indicative of infection. But also, you know that your CRP is considered to be an interfering substance if you are going to examine for antibodies. Okay, so regardless if there is a high titer to the Salmonella typhi antibodies, but at the back of your mind, knowing CRP having high levels could be interfering your testing. So therefore, you just have to simply remove your CRP, and that is mainly by heating the serum of the patient to 56 degrees Celsius for 30 minutes, okay, to avoid interferences of CRPs for antibody detection. Okay, although the result coincides, okay, but there could be instances na, for example, if the CRP level is high, okay, pero yun pala, negative si patient sa bacterial infection. Okay, there could be other reasons why the patient's CRP levels is high. So it could be due to another form of inflammation. Okay, so kung ingon ato ang iyahang reason, kani imuhang high titer, mali na gid ni siya, right? So that's why you have to be sure, okay? So the best thing to do is you have to repeat the testing, okay, and heat the serum to avoid interferences of CRP. So after heating, if mataas talaga ang titer ng antibody ng patient against Salmonella typhi. Okay, so therefore, it is truly a Salmonella typhi infection. Okay? So, asking the phlebotomist to collect your sample, hindi na necessary. Okay, you are just simply adding pain to the patient by collecting new samples when actually you can use the serum sample of the patient. Okay? Inform MedTech B to perform HSCRP test. Okay, remember that your HSCRP is mainly to detect very minute amounts of CRP. Eto, 768. Okay, so no need for you to perform HSCRP. You only perform HSCRP if the levels or if the doctor has um, doubted na may infection si patient, but then sa agglutination testing natin is nag-negative, okay, knowing that the sensitivity of your agglutination test is mainly 5 milligrams per liter. So lower than this, okay, hindi madedetect. Okay, kaya tayo nag-perform ng HSCRP. Okay, so the best answer would be to heat the serum, okay, prior to retesting. Next, which of the following statements is or are true? Okay, so because the levels rise and then decline rapidly, CRP is the most widely used indicator of acute infection or inflammation. Totally. Okay. So that's why it is widely used as an indicator of inflammation because without the signs and symptoms, your CRP is already going to rise. And because of its rapid decline, okay, the moment the stimulus of that particular infection or inflammation has ceased, okay, so CRP levels will fastly decrease also. Okay, so CRP is a non-surgical means of following the course of organ transplantation because very low, not low, okay, but rather high levels can mean the beginning of organ transplantation. CDC has recommended that CRP concentration of more than 3 milligrams per liter is associated with no. It's not average, but rather high. Okay, so CRP levels of 4 milligrams per liter can be detected with the use no. Okay, because ang sensitivity ng rapid latex agglutination assay that the CRP of the patient must be at least 5 milligrams per liter. So if it is 4 milligrams per liter, you cannot detect it with the use of rapid agglutination assay, but rather you have to make use of HS-CRP method or the HS-CRP test. So what is the method utilized for high sensitivity C-reactive protein test? Okay, of course, so that is immunoenzymometric assay. The rest are actually semi quantitative testing. Ah, only capillary precipitation and radial immunodiffusion for um, qualitative and semi-quantitative determination of CRP levels. Western blot is the confirmatory testing for HIV. Which of the following are the reasons leading to false positive results for CRP? Okay, so you have the following choices. Reagents stored were reagents used were stored at room temperatures lower than 0 degrees Celsius. So this is freezing temperature. So it would lead to spontaneous agglutination reaction. So false positive ni siya. Okay. Refrigerated reagents were used right away upon retrieving them. So meaning not allowing them to be thawed at room temperature. So it could lead to false positive. Kasi nga, once your latex agglutination reagent is going to be refrigerated, it could lead to sedimentation. So if hindi mo siya ito at room temperature, then it will continue to do, or it will the sedimentation will not be removed. So therefore, it could lead to false agglutination reactions. So glass slides for testing was not properly washed and cleaned prior to use. So remember, not all kits tend to give you disposable cardboard slides, okay? Sometimes hindi sila maka-provide, but the laboratory will have their glass slides, okay? This is usually black, okay? Black in color so that it is going to contrast with the reagent utilized. Kasi if you are going to make use of a slide that has the same color as the reagent, or it could be clear, like the conventional glass slides we use in the laboratory, you cannot appreciate or detect the presence of agglutination reaction. What if the agglutination reaction is 1 plus or 2 plus, which is weak? So mahirap siya tingnan if you have the same color of the slide. So it has to be in contrast to the color of your reagent. So since the reagent for CRP is usually white. Okay, common for latex agglutination reactions would be a white reagent. So glass slides utilized must be in color black. Okay, so if your glass slides, okay, if it is reusable, if not properly washed and cleaned prior to use, then therefore, okay, it could lead to the presence, or it could have presence of contaminants that could lead to false positive results. Okay, so the suspension of latex reagent was done prior to dispensing on the slide. So remember, if you are going to use your reagent, okay, prior to using your reagent, you have to do the suspension to ensure homogeneous mixture of the reagent. So this is actually the right thing to do. So it could lead to false positive results. So only A, B, and C are the answers. Okay, next. Male medical technologies performed the slide agglutination method for CRP with reagents, noted to be in excellent condition prior to testing. So therefore, there is no problem with the reagent. Upon mixing the patient sample and the reagent, he placed the slide on the slide rotator and processed other pending samples while waiting for the reaction time to finish. Okay, so the scenario is that in the laboratory, we tend to do multitasking. So once we are incubating something, we are not going to do nothing and wait for the incubation to end, but rather we are going to perform other procedures. But the problem with these medical technologies is that he forgot that he is having that he is performing a agglutination test and placed it in the slide rotator. Okay, so due to whatever reason, okay, it could be acceptable or not, the thing is that nag-overtime. So he was able to read the results after 3 minutes and notice agglutinations on the patient sample and all control. Imagine all control. So what must he do? Okay? Knowing na hindi dapat magkamali ang control because you were assured that excellent condition prior to testing ang reagent. Okay? So what happened, okay, with regards to the false agglutination reactions, that is merely due to the okay, nagsobra ang incubation time. So there is a possibility that the samples and the reagents could have dried, okay, in the slide. So drying of the slide could lead to false agglutination reaction. So what are you going to do? Repeat the test with the use of new reagents? No. They are in excellent condition, so no need for you to use new reagents, okay? And then repeat the test and read the results exactly after reaction time? Yes, okay? Although this can be done, but as much as possible, you have to avoid uh, performing tests repeatedly. because the costing of the reagent is usually for one test per patient. Okay? So hindi we cannot afford na magsige na lang ulit ng perform or repeat if you have doubts because ang tendency niyan baka ang medtech na ang magbabayad ng test. Okay? So avoid making errors so we can actually save up the reagent. Okay, so remember that the reagents are not cheap. Okay, they are quite expensive. Repeat the test on controls but not on the patient sample. Okay, no. Okay, so lahat you are going to check. Okay, not just on the patients, not just on the control, but also on the patient sample, knowing that you have exceeded, okay, the reaction time. Repeat the test by preheating the serum. Okay, no. Okay, this is not actually the problem. Although later on, if the same problem would occur, okay, probably you are going to do other troubleshooting. But based on the problem, okay, so that is mainly because of uh, exceeding reaction time. So the best answer would be to repeat the test, okay, and reread the results, okay, read the results rather after the exact reaction time. So what is the diluent used for semi-quantitative determination of C-reactive protein levels? Okay, so I would like to apologize because actually in the procedure that I have posted in Canvas, I mentioned saline solution, okay, which is actually not the case because it is usually glycine buffer. So the glycine buffer could be in liquid form, usually in liquid form, but at times meron ding mga lyophilized, meaning they are in powdered form, and then you are going to add water, okay, to dilute that, okay. But in most cases, in what I have actually performed in the laboratory, glycine buffer is in liquid form. So when you do semi-quantitative assay, you just have to get 1 ml of glycine buffer plus 19 ml of distilled water. Okay, so that is having a total volume of 20 ml. So that is what you are going to use for performing the titration, okay, for semi-quantitative determination of CRP levels. So distilled water is not the diluent for testing, but rather it is the diluent for the diluent that is utilized. Okay, kasi si glycine buffer i-dilute pa. Okay, but for the testing, it has to be diluted glycine buffer. And acetate buffer is also a diluent but not on CRP. Usually utilized for other chemistries and other immunologic or serologic methods. So next situation. A medical technologist performs CRP testing in qualitative methods. So therefore, that is mainly in latex agglutination assay. The reagents were thawed at room temperature with no signs of contamination present. So therefore, the condition of the reagents were good. Okay. So the medtech used the supernatant of the patient's centrifuge blood from the EDTA tube. So therefore, this is non-coagulated blood. So if you are going to get the supernatant, that is referring to plasma, okay, and gave a negative result, okay. Since there was no problem with the control, the result was released. An hour later, the doctor called the laboratory and questioned the result when the patient had fever by the time the sample was collected. So, nag-fever na. Imagine, CRP levels are going to rise before the symptoms are going to be observable, okay? So, kung naa nagiging fever ang patient, so expected na nagyud na taas na gyud ang CRP. That's why the doctor has questioned the result. Bakit wala? Okay? So, what could have caused such problem? Okay? The doctor doesn't know how to interpret results. Okay, no. Okay. The doctors have practiced, okay, for many years. Okay, so it would be impossible that they don't know how to interpret the results. Okay, the positive control gave a negative reaction. False, because there was no problem with the control. Okay, the thawing of the reagent caused sedimentation. No, because the situation said that the reagents were thawed to room temperature with no signs of contamination present. But that could be attributed to the wrong sample that was used. Okay, remember that your EDTA is anticoagulated. Okay? So therefore, walang clotting process na nangyari. So therefore, you have here your clotting factors, which is actually in a form of protein that is also synthesized in the liver along with where your CRP is being synthesized. Okay? So remember that in serology and chemistry, the reason why we do not um, use plasma, okay, in testing, mainly because it is anticoagulated. So one thing is that the anticoagulant could have interfered with the testing. Okay? So kaya ina-avoid talaga natin ang plasma. And aside from that, clotting factors, okay, since they are also in the form of proteins, could actually be interfering. So ang question dito, bakit naging negative? Okay? Remember, okay, if there is high presence of CRP, uh, yes, okay. Minsan kasi we have the post zone phenomenon. Okay, so meaning taas kaayo ang amount of antigens compared to the amount of antibodies. And remember what is incorporated in your reagent is the antibody. So kung daghan kaayo siya og antigen, okay, so we are going to miss, okay, the formation of lattice, which is actually the one that causes visible agglutination. So kung ingon ana ang mahitabo tungod kay anticoagulated, napagyoy anticoagulant, di pa gyud siya serum, plasma pa gyud siya, wala nag-clot. So daghan kay clotting factors nya possible pa nga taas pa gyud siya og CRP. Okay? So that's why nag-post-zone phenomenon na siya. Mo na possible nga nag-negative ang result. Okay? So make sure that you are going to make use of your serum. So dili jud usually ginagamit ang plasma. Okay? So next. A patient was suspected to have infection 5 days after a successful surgery. So the physician requested for CBC, ESR, and CRP. So these are mainly the three tests, okay, to detect the presence of inflammation or infection. So ang CBC mismo, actually, they are looking for the WBC. So if you are going to question, ma'am, nganong dili WBC lang ang ipatest, okay? So since WBC is already incorporated in your complete blood count, if you are going to test for WBC alone, the cost of the test is almost the same as CBC. And then, murag gamay lang og diferensya ang ilahang price. Tapos, ang makuha nimo nga result is WBC lang. Whereas, kung mudungag na lang ka siguro og 50 pesos, CBC na imong makuha na anay, hemoglobin, hematocrit, RBC indices, you have your RBC count, you have your WBC differential count, as well as platelet. Okay? So, it would be convenient also to determine CBC since post-op siya, okay, post-operative, baka may internal bleeding. So, titingnan din ng doktor kung normal pa ba ang hemoglobin, hematocrit, at saka RBC count. So, it would be best to have CBC, okay? ESR and CRP. So, the results are as follows. WBC count, 9.8 times 10, dapat to the 9th power ni siya per liter. Okay? So, that means, is it normal? Yes. Kasi 5 to 11 times 10 to the 9th power per liter ang normal range ng WBC. ESR, yes, it is normal. Kasi as I have stated, okay, you have 0 to 25 millimeter per hour ang normal value. So since it fell on 1 millimeter per hour, so within normal range. But the CRP is high. So if you are going to be the attending physician, how will you interpret the results? Okay, the patient has no infection since all results are normal. This is not normal. Okay, so X na ni siya. The patient has infection because the CRP levels are beyond the normal value. Definitely. Okay, kay kung imong tan-awon na ang CRP lang ang taas. Kani normal, kani normal. Okay? The patient has no infection because only CRP is increased, but not the other markers of infection. Remember, CRP is a sensitive, okay, test, okay, for inflammation because of its rapid increase during infection and rapid decline if wala na ang infection. Okay? So you cannot say that there is no infection kasi increase na si CRP. Okay? Although normal ni siya because remember, CRPs are already increased kahit si WBCI normal pa rin, okay? And actually, si ESR, siya ang pinakamas matagal, okay? So, one advantage of having CRP test over these two, okay, as a marker for infection and inflammation is that your ESR has a long turnaround time, a long turnaround time. Why? You are going to wait for the settlement or the sedimentation of your red cells for 1 hour. Okay? So, dugay gid kay siya mahuman. Si WBC count mas paspas. Oo, yes. But, okay, there could be a tendency that your WBC counts will still be normal, okay, even if there is already uh, early signs of infection. Okay, so mas reliable yun si CRP. Okay, so you cannot say na no infection because CRP is already increased. The patient has infection because CRP and WBC count are elevated. This is not elevated. This is still normal value. So the answer is the patient has infection because CRP levels are beyond the normal value. Okay, next. Qualitative test for CRP can indicate levels below 5 ml by observation of visible agglutination. No. Okay? Di ba ang iyahang sensitivity is, ang madetect niya is higher than 5 milligrams per liter. So kung less than 5 na siya, dili na siya madetect with visible or walay agglutination reaction. Okay? So false na ni siya. Okay. The determination of CRP levels using serial dilution can supply the specific quantity. No, it's only semi-quantitative. So still it's false. So both statements are false. Okay. A patient diagnosed with SLE was delivered in the ER complaining of severe joint pain. This is actually one of the manifestations of serum lupus erythematosus. That's why it has to be differentiated with gouty arthritis as well as rheumatoid arthritis. Okay, so CRP levels were requested and the results were normal. Okay, no problems were encountered during the testing. So what is the best explanation of the situation? Okay, the answer is that CRP is not increased in SLE despite active inflammation. So remember that your CRP is a very good marker for inflammation and infection, but not on SLE because there have been, as mentioned by, I think it's Stevens, okay, na even if there is existing SLE, okay, CRP levels will still be low, okay, or normal. And knowing that your SLE from the word systemic, so it is going to attack, okay, any organ. So multi-organ ang iyahang problem. Okay, and in which, di ba, kung multi-organ, so dapat taas o cases sa inflammation. But levels were not really increased. So normal lang gihapon siya, okay? Actually, one of the, with regards to joint pain, okay, if the doctor is going to differentiate or to have a differential diagnosis between SLE and RF, okay, so they are actually going to look at CRP. Kasi sa RF, mataas masyado si CRP. But in SLE, hindi. Okay? So, this is the right answer. There is problem with testing since inflammation is always associated with high levels of CRP. No. Okay? Especially with SLE. Okay, you have your ulcerative colitis also. So, most of the autoimmune disorders do not actually lead to increased CRP levels. Okay? So, the patient's joint pain is due to another joint disorder such as rheumatoid arthritis. Patient is already diagnosed. Okay? So, kung moingon ka nga naa siya another joint disorder, RA pag yun, okay, di day RF, RA pag yun, rheumatoid arthritis, okay? So, dapat increased kaayo si CRP. But in this case, normal. So, hindi ito. The result is valid since the doctor did not complain about it. Okay? So, kung nagani nito bag-ani, okay, grabe na gyud. Okay? So, uh, the doctor did not complain, okay, most likely because, okay, alam na niya, okay, diagnose si patient with SLE. Okay? So, It doesn't mean because they did not complain, okay, so walay problem sa procedure. But from time to time, you really have to detect all the errors present, okay, during the processing. So you have, remember, if you will recall, you have analytical, pre-analytical, and also post-analytical. Okay, so be careful with errors when you are in the laboratory. So next situation, a female medical technologist was about to process a serum sample for CRP when she was called to the ER ward of the hospital to collect samples from 10 patients who are victims of a vehicular accident which happened near the hospital's vicinity. Okay, so there could be a tendency, although I did not mention the shift, but there could be a tendency that you will be alone left in the ward, in the lab rather, and all of your other colleagues were doing rounds. Okay, so while the female medical technologist was processing, okay, CRP, okay, tinawag sa ER, okay, na ay emergency na ipakuha. So if you are going to analyze the situation, vehicular accident, okay, so expect that there could be broken bones, okay, there could be cuts, okay, or severe injuries that could actually lead to blood loss. So that's why pag ingon ani gani ang mahitabo, pag sinabi ng ER na stat, okay, na blood collection, punta agad, okay? Because there could be instances that all of these patients or some of those patients would require immediate blood transfusion. So dili pwede nga ay humanon sa nako ako ang buhaton o na ko moadtog ER no. So you really have to prioritize this one. So what would be the best thing to do? Okay? So remember, if you could not process the sample right away, okay, you have to place it in a tube, okay, and store it in the refrigerator. And then you come back, okay, from collecting blood samples from the ER. Then that's the time that you are going to process. So why in the ref only? Okay, I think you are not going to be away for more than 8 hours. Okay. So, ref lang. Okay. Kasi pag i-freeze natin, usually it will take kung the processing would be delayed for more than 24 hours. And remember, ang problem kasi natin sa ang maganda kasi sa refrigeration, kasi pag once ma-thaw mo siya, uh, ang sample, okay, I think pwede mo pa siya ma-ref ulit. Pero pag naka-freeze na kasi and then you are going to thaw it, to room temperature, hindi na kasi siya pwede refreeze. Okay? So, dili na siya pwede magamit. So, best for ano is refrigeration lang yun. Okay? Pero kung more than 24 hours na yun, it has to be frozen. Kasi hindi rin okay na magstay siya for more than 24 hours at the ref. There could be changes. Mas ma-preserve kasi pag naka-freeze. Okay? And then, you cannot ignore the call and continue testing the sample. As I have mentioned a while ago, all of the patients could be requiring immediate blood transfusions. Kailangan emergency transfusion, kailangan immediate cross-matching. So, kailangan may sample agad. Then, you heat the patient sample. No, heat the patient sample. No need for you to do heating. Okay? And test it by the time she returns in the lab. Why would you heat it when you are actually processing for CRP, which is sensitive to heat? Okay, so hindi pwede. Tignan ito, not this one. So this is the best answer. Okay, next. The following tests are done. The following are tests done to indicate the infection, except, okay, of course, this one. Okay, albumin levels, no. This is actually to determine the level of dehydration. Pagtaas kay si albumin, meaning dehydrated. Okay, so next. Which of the following, although albumin is not only for dehydration, okay, so there could be underlying protein problems in the body that could lead to determination or that could lead to a need for determining the levels of albumin in the blood of the patient. So which of the following cytokines induce the production of C-reactive protein in the liver? Okay, so although acute phase reactant production is dependent on the following substances, you have interleukin 6, interleukin 1, and TNF alpha. Okay. But of course, for the production of CRP, it is mainly due to interleukin 6. So interleukin 1 and TNF and also interleukin 6 could also lead to the production or to the release of other acute phase reactants. You have ceruloplasmin, you have um, fibrinogen, okay, mannose binding protein. Okay, so, but for specifically CRP, it is reactive to interleukin 6, okay, in the liver. What particular cell? That is in the hepatocytes, okay. So the following conditions can be determined by examination of CRP levels, except, okay, organ rejection. Yes, pag increase na CRP, that could lead, it could be a sign of the beginning of organ rejection to those patients who are being transplanted with organs. Colon cancer, this is malignancy. Increased CRP is actually monitored in order to determine if there is recurrence of of malignancy. So most patients who have undergone chemotherapy and removal of tumors, they are going to be monitored for CRP levels, and that is mainly to determine if the malignancy has recurred. Okay, and of course, coronary artery disease. So atherosclerosis. Okay, so you have low, average, and high risk. But SLE, okay, is not indicative. It does not induce, okay, the production of CRP. Which of the following are non-specific indicators of inflammation, trauma, or infection? Okay, so CRP, ESR, and WBC are all markers of inflammation and infection. Okay. However, okay, all of them are non-specific. They can detect the presence of inflammation or infection, but they could not identify what particular inflammation or infection, which particular organ is affected by having these three alone. But rather, it could detect inflammation or infection, and then you are going to, or the doctor is going to make use or to request for other tests, okay, to narrow down the possible causes of inflammation until they are going to come up with a particular diagnosis. Okay, so of course, it's A, B, and C. They are non-specific. Okay, pag sabihin kong specific indicators, wala sa tatlo ang answer. Okay? Next. CRP is reactive to what particular component of the bacterial membrane? Of course, okay, phosphocholine. Okay, that's why it is much more increased in bacterial infection than viral infection. So which of the following statements is or are true regarding the CRP agglutination test? The agent is composed of antigens which are carried by latex particles suspended in the solution. Wrong. Okay, what is being suspended in your latex particles is not the antigen, okay, but the antibodies. Okay? So, wala na kay A. So, dili na ni Mao. So, nana lang ka sa B ug D. Okay. So, the test detects the presence of CRP antibodies in the patient's serum? No. We are using or we are going to detect, okay, the presence of CRP, okay, with the use of antibodies. So, si CRP ang ating antigen. So, mali na ka. So, that is letter D. So, that is how you are going to answer for more types of questions. Okay? So, pag once na agay kay sure nga isa ka choice na mali na gyud, so unsa tong mga choices na nag-involve ana nga letter, so wala na to. So, you are able to narrow down your answers. So, of course, wala may choice nga C ug D. So, most likely mali gyud ni si C. So, a false positive result can be attributed by post-zone phenomenon? No. Sana, um, unsa itong isa, prozone and post-zone, okay, are all going to lead to false negative result. Okay, not false positive. False positive can be attributed by technical errors. So drying of the slide, okay, exceeding reaction time, or there is increased sedimentation of the reagent, or there could be use of frozen reagents or unthawed reagents. So yun usually ang makakause ng positive, false positive result. But for zonal reactions, prozone and postzone is usually false negative. So D is the right answer. Intensity of agglutination is not indicative of CRP concentration. Okay, so we are just going to read it based on the agglutination reactions if it is 1 plus, 2 plus, 3 plus, or 4 plus. But, okay, it doesn't mean that if you have 4 plus, there is increased presence of CRP. Okay, indirectly, yes, it may indicate, but uh, hindi talaga siya ma-quantify. Okay, only with the use of um, tube, because mainly by grading your agglutination reactions. Okay, next. In reading the reaction of the agglutination test, which of the following describes 3 plus reaction? Okay, ito actually, this is 1 plus, okay, 2 plus, so 3 plus, and this is 4 plus. So of course, this is number 3. Okay, moderate clumping with fairly clear background. Large clumping with with clear fluid background, that is 4, 4. So 3 and 4 are actually strong. Okay, so 1 and 2 are actually weak. Okay, so later on, if you are going to do a lot of agglutination tests, we have actually what we call as mixed field results. Okay, so dili lang 1, 2, 3, 4. So in order to not to complicate your um agglutination testing. Okay, so start lang muna tayo sa 1 plus, 2 plus, 3 plus, and 4 plus. Huwag na yung mga mixed field, medyo nakakalito na. So that would be encountered in blood banking already. So which of the following conditions can lead to a false result of the agglutination test? Okay, false result. So this is mainly technical errors. Use of a frozen reagent? Yes, okay. Application of reagent without prior resuspension? Yes, kasi nag-sediment siya sa bottom. Okay, so hindi homogeneous ang mixture. So, reading of reactions 1 minute exceeding the required reaction time, of course, okay, it could lead to drying of the samples, okay? Using plasma as a sample, okay, yes, okay, and that is mainly because of the interfering proteins, okay? So, A, B, C, and D is the right answer. Wala naman sinabi ditong false positive. Okay, so kasi minsan pag plasma kasi nagli-lead to false negative because if there is too much presence of proteins, it could lead to post-zone phenomenon. Pero ang sabi dito false lang naman eh. So included si plasma. So you have A, B, C, and D. Which of the following samples are contraindicated to be used in performing CRP rapid agglutination test? Of course, plasma is not to be utilized. Lipemic, yes. When you say lipemic, there is actually too much presence of lipids in the sample, okay, in which usually the sample of the patient is already turbid, okay, and because there is increased presence of lipids, okay, it is going to mask agglutination reactions now, okay, so hemolyzed, no. Okay, again, hemoglobin has a protein chain, so it could actually interfere. And then you have samples with bacterial contamination. So anything that has discoloration, that is actually indicative of bacterial contamination. So all of these are contraindications. So therefore, you have A, B, C, and D as the right answer. Okay, what is the principle of the rapid test for C-reactive protein? Okay, that is reverse passive agglutination. Okay, not direct because direct agglutination makes use of antigens that are carried by particles in which they are naturally found. Okay, indirect naman, okay, the antigens are incorporated in particles that they are not usually found. So in the case, it is latex particles, the most common. Okay, so remember that with direct and indirect agglutination, we are looking for anti ano, we are looking for antibodies in the plasma of the serum. And what is incorporated in your reagent is the antigen, okay? Passive agglutination is the other name of indirect agglutination. So reverse passive agglutination, why passive? Because we are making use of okay, bakit reverse? Okay, because what we are looking for is not the antibodies, but antigens. Okay, why passive? Okay, why reverse? We are looking for antigens, so therefore your antibodies are incorporated in your reagents. Okay, so why passive? Because it's your antibodies that are attached, okay, to the latex particle. Okay, so that's why it is different from direct and indirect agglutination. Okay. So, okay, so that is reverse passive agglutination. How long is the incubation time of samples tested using radial immunodiffusion? Okay, so again, bakit hindi na masyado ginagamit si RID? Because of the long turnaround time. Okay, remember, depending on the sample, urine is only up to 24 hours, but for serum samples, it is usually 24 to 48 hours. So the answer is 24. Although I did not indicate 48, so of course, this is understandable. It is not going to be less than 24 hours. Okay, actually, for serum samples for RID, this is the shortest, okay, incubation time. Okay, so di na gyud pwede ang 2, labi ng 2 minutes and 12 hours. So, this is the least key incubation time for radial immunodiffusion. CRP has a shorter turnaround time than erythrocyte sedimentation rate. This is actually true. CRP levels increase during infection when WBC count is still within normal limits. So this is also true. So this is the answer. Both statements are C-reactive protein was first discovered in the serum of patients infected with what particular organism? Okay. So that was because hence the name CRP, okay, C reactive protein because it is reactive to the protein C of your Streptococcus pneumoniae, the causative agent of lobar pneumonia. Okay, so doon na-derive ang kanyang name. So in radial immunodiffusion, levels of CRP can be determined by, of course, measuring the diameter of the precipitin ring. So not agglutination reactions, precipitation in a solution with the antigen. So that is capillary precipitation, and measurement of light is mainly nephelometry. So the following are methods for semi-quantification of CRP, except, so we are looking for semi-quantification. So RID, yes, by reading the precipitin ring, and that has a tawag na corresponding value, okay, which is an estimation of the amount of CRP. Capillary precipitation, although it is in the tube, okay, so to determine the approximate amount of CRP, so you are still going to perform titers, okay, so you perform serial dilution. And latex agglutination are all semi-quantification. So nephelometry is actually the okay, quantitative okay, measurement of CRP. Okay, next. Okay, that is actually the last one. So okay, so I hope, although I have observed that most of you were able to get uh, good answers, okay, so I hope you are going to keep up with that, okay, until the end of the semester, okay, so we can see each other in the next sem. So, okay, before I end this, so I want to thank you, okay, for listening and have a great day. Okay, stay safe, everyone.